Hi guys, can you all hear me?
Yes, ma'am.
All right. And can you all see the slides as well?
Yes, ma'am.
Okay, all right. Okay, so guys, so far we have only four students over here in the meeting. Okay, so let's wait another like 2-3 minutes for the others to join as well. And then I will be starting the lecture. Okay, so I'll be starting around 9:05. Let's give some few minutes for the others to join. All right, so screen now. Can you guys see the slides in full screen mode?
No, miss.
Oops. Let me check. How about now? Can you all see it in full screen?
No, ma'am.
Okay. Is it still in the
No,
normal
it is
view?
black.
Oh, all right. So let me.
Okay, now can see, but not in a full screen.
All right. What about now, guys? Can you all see in full screen now, or is it black?
Black, miss.
Okay. Guys, is it just black, or can you see a buffering symbol as well? Can you see that loading symbol, or is it just black?
Black, miss.
Black.
Okay. Let me share it once again. How is it now, guys? Can you all see it in full screen?
No, ma'am.
It's in full screen, but still black, miss. Can you scroll a little bit down? Up?
Yeah. Can you all see the slides moving, or
No, no.
just black?
Yeah.
Okay. So then what we can do is.
Now
So,
okay, ma'am.
but now you can't see it. Now it's not in full screen, right?
Yes, it's okay,
Yes.
miss.
Shall we do like this, guys? We can zoom it. Okay. Let me try. Yeah, so can you guys see the content clearly? ලියලා තියෙනවා පේනව නේ
Yes.
slides වල?
Yes.
Yes.
Okay.
Yes.
හරි. Then we can do it this way for today. All right. So guys, yeah. So today will be our lecture 4. Okay, so this is today's lecture number 4 for this module, communication in the caring professions. All right. So this is the content that you will be learning in today's lecture. Okay, so you will basically learn about communication systems and practices, and then you will learn how can you improve communication systems and practices. Okay, so first of all, we will talk about communication systems, and then we will move on to communication practices, and then we can discuss about the improvements that we can make to communication systems and practices. Okay, so basically you will be learning about communication systems, communication practices, and what are the improvements that you can do to these communication systems and practices to improve their effectiveness. Okay, so we can start off by discussing communication systems. Okay, so guys, based on your understanding, what is a system? Like, what does the word system mean? You just forget about the word communication. So can you tell me what does the word system mean? System එකක් කියන්නේ මොකක් වගේ එකක්ද? What are the characteristics of a system? Okay, so you can talk about any system that you can think of.
Set of things working together. Set of yes.
Exactly, that's a really good answer, Taranga. Thank you for answering the question. And what about others? Do you all have any points to add to Taranga's answer? Okay, so in a system, like Taranga said just now, we have several things, several different things working together. Okay, and what else? What else can you add to that answer? Like why do we need systems? What is the purpose of having systems?
Connecting all network.
Sorry, Taranga?
Connecting all the things.
Exactly. Yes, that is a main reason for having a system. Okay, so when we have a system, it is easy to connect all the elements, and it is like it is easy to when the things are connected to each other, the entire process is neat. Okay, and so we can run that particular process smoothly when every thing is connected to each other. Okay, so that's a really good answer once again. Yes, that is a main reason for having systems in general. Okay, so now we are not talking about communication systems. We just discussed about like any system in general. Okay, so yeah, so in a system we have several different things connected to one another. Okay, so one of the main reasons for having a system is, like you said, when we have a system, when different elements are connected to each other, it is very uh, like it is easy to network. Okay, it is easy to build uh, relationships with other people, collaborations with other people. It is easy to communicate. Okay, likewise, it is very easy for us to network with people when we have a certain system with several elements. Okay, so communication system is a system related to communication. Okay, so communication systems are basically the structures. Communication systems are uh, certain structures that you have in your organizations to support the communication needs. Okay, so not so in this autumn qualification, we are talking about health and social care sector. Okay, but communication is not something limited just to health and social care sector. Communication is communication is a requirement needed by like all the sectors in this world. Okay, not only health and social care. Health and social care is just one sector, but communication is needed by all the other sectors as well. Okay, so I think when we I'm not sure in which lecture, in our first lecture or in our second lecture, when we discussed about communication, I taught you guys that communication is a lifelong process, right? It's something that we do throughout life. Since the day we are born to this world and since the day we die, throughout this entire period of life, we engage in communication. Okay, so communication is very much needed in all sectors. Okay, so in this module, we are particularly talking about health and social care sector. Okay, so we will be learning about communication systems in health and social care sector in today's lesson. Okay, so communication systems are structures or systems which are there in organizations to support their communication requirements. Okay, so these communication systems can be formal or informal as well. Okay, so organisation එකක් වුණ පමණින්ම the organisation එකක් කිව්වහම what we mostly think is that communication should be formal all the time. Okay, කියන්නේ organisation එකක් කිව්වම අපිට එකපාරට ඔළුවට එන්නේ communication කියන එක හැමතිස්සෙම organisation එකක formal වෙන්න ඕනේ කියලා. Okay, so yes, most of the time it has to be formal, but it doesn't mean that you cannot have informal communication at all in an organization. It doesn't mean that you are not allowed to have informal communications at all. Okay, so because sometimes there can be situations where you need to communicate informally as well. Okay, so for example, in a workplace, in an organization, there can be situations where you have to talk to your supervisors personally. Right? ඒ කියන්නේ අර one to one discussion එකක් අර තනියම ඒ අදාළ පුද්ගලයාත් එක්ක විතරක් කතා කරන්න ඕනේ වෙන අවස්ථා ඉන්න පුළුවන්. one to one discussion එකක් one to one discussion එකකට යන්න වෙන situations එන්න පුළුවන්. එතකොට ඒ වගේ one to one discussions අපි ගන්නෙ because like when you are engaged in a one to one conversation, it is sort of informal, right? It is sort of personal and informal. Okay, so then it is easy for you to express yourself. Okay, so ඒ වගේ situation එකක් අපිට ගන්න පුළුවන් as an informal communication. One to one discussions informal communication එකක් විදිහට ගන්න පුළුවන්. Okay, and at the workplace when you talk to your friends, like your workmates in your workplace, you are not working alone, right? Not only in health and social care sector, in any sector, in any kind of a workplace, you are not working alone, right? You are working with your colleagues. Okay, so sometimes when you talk to your colleagues, sometimes it can be informal as well. Okay, so communication systems. So that's why communication system should not be 100% formal, or it should not be 100% informal. Okay, because in a workplace, in an organization, we have both formal and informal needs. Okay, so communication systems should cater to both formal and informal needs. Okay, so communication systems are basically systems or the structures that we have at our workplaces to support the communication requirements. Okay, so these systems can be formal or informal. Okay, so yeah, so when I asked you guys what is a system, one of you guys, Taranga, mentioned that in a system we have several things connected to each other, right? You just mentioned that a system is a collection of several elements. Okay, so it applies to communication system as well. Okay, so a communication system is also a system which is made up of several different elements. Okay, so in a communication system, we have people, we have messages, we have technologies, we have organizational structures. Likewise, we have all these different kinds of elements. Okay, so these elements are different from one another. So so I have highlighted the elements of the communication system in this second sentence. So the first element is people, messages, technologies, organizational structures. So when you look at these four things, you can see that they are different elements, right? People are not related. I mean, people are people, messages are messages. Technologies are different from people and messages. Technologies is something like completely different. Okay, and then organizational structures කියන්නේ people, messages, technologies තුනම නෙමෙයි වෙනම එකක්. Okay, so likewise these elements are completely different from each other. Okay, so in a communication system we have different elements, several different elements, but these elements are connected to each other. Okay, because it is extremely important to make sure that these elements are well connected to each other, because if these elements are not connected, then the communication system will collapse. Okay, the communication system will not be successful if the elements are not connected. Okay, so it is extremely important to make sure that we have all these several different elements connected to one another. Okay, so from next slide onwards, we can learn about these elements in detail. Okay, so in the second sentence, I just roughly mentioned the elements, people, messages, technologies, and organizational structures කියලා හතරකට මම roughly mention කරලා තියෙන්නේ. But from this slide onwards, මේ elements හතරත් අපිට we can break these four elements down further into further small elements. Okay, so for example, technologies කියන එක මෙතන technologies කියන එක we can technologies කියන එක we can break down further into several other components as well. Okay, so technologies can be broken down as communication channel. ඊට පස්සේ අපි තව element එකක් කතා කරනවා communication tools කියලා ඉස්සරහට, communication services, communication devices. Okay, so likewise in the second sentence, I just mentioned the elements roughly as people, messages, technologies, organizational structure. මේ හතරත් තව sub elements වලට බෙදෙනවා. හරිද? එතකොට from this slide onwards you can learn what are the එහෙම මේ elements උත් බෙදුනට පස්සේ මොනවද ඔක්කොම communication system එකක තියෙන ඔක්කොම elements මොනවද කියලා you can learn from this slide onwards. Okay, so if I'm not mistaken, we are talking about 8 elements. Yes, 8 elements. Yeah. Okay, so in total, we are talking about 8 elements that are included in a communication system. Okay, so we are talking about communication channel. So these are the elements of a communication system. Okay, so these elements include a communication channel, types of messages, communication policies, agents, communication services, communication devices, interaction mode, and security protocol. Okay, so these are the 8 elements of a communication system. All right. So first of all, we can talk about communication channel. Okay, so so in our first few lectures, we discussed about this word channel. So can you recall what we learned in those lectures? What does the channel mean? When it comes to communication, what is a channel? If you can't remember, that is fine as well. You can just guess and tell me your answer. What do you think a channel is?
Way of communication.
Okay, that's a really good answer, Taranga. Yes. a way of, yes, we can consider it as a way of communication. Okay, so yes, so communication channel is actually, it's the pipe along which a message is delivered. Okay, so there are several different communication channels. Okay, some examples for communication channels are face-to-face conversations, and then telecommunication channels like telephone or email. Okay, and then we have computational channels like medical records. Okay, so these are some examples of communication channels. Okay, so communication channel is basically a pipeline. Okay, so it's basically the pipe along which the message is delivered from one person to another person. Okay, so the pipe through which the message travels. Okay, so the examples for communication channels are face-to-face conversations, telecommunication channels. Telecommunication channels කියන්නේ telephone conversations or email conversations. Okay, or as computational channels. Okay, computational channels කියන්නේ channels that involve computers, like computational devices like medical records. Okay, so basically its channel means the pipe through which the message travels from one person to another person. Okay, so these channels, so I told you that I just mentioned that there are different channels. Face to face conversation කියන එක channel එක. Telecommunication channel කියන්නේ තව වෙනස් channel එක. Computational channels කියන්නේ තව වෙනස් channel එක. හරිද? Telecommunication channels include telephone and email. Telephone and email කියන්නේත් ඒ දෙකම telecommunication channels වලට අයිති වුණාට they are different as well. Telephone conversations are very different from email conversations. Right? So අර එකම වර්ගයකට අයිති ඒවත් එකිනෙකට වෙනස් වෙන්න පුළුවන්. For example, telephone or email conversations, they both fall under telecommunication channels, but they both are different from each other. Right? Telephone conversations and email conversations are very different from each other. Okay, so these different types of channels have different characteristics. Okay, so face-to-face conversations have certain characteristics. Telecommunication channels have some different characteristics. Computational channels have some different characteristics. Okay, so can you give me an example for these differences? Like මොන වගේ differences ද තියෙන්න පුළුවන් කියලා can someone tell me? Okay, so I'll make the question easier for you guys. So let's take a telephone conversation and an email conversation. So these are two different channels. So how can these two be different? How can a telephone conversation can be different from an email conversation?
Email is the written communication, and the telephone is the verbal communication.
Okay, very good, Taranga. That's a really good answer. Can I hear from you guys as well? From the rest of the class as well? You can tell me any difference between telephone conversations and email conversations. Whatever you think about telephone conversations and email conversations.
In the telephone conversation, there's a dial the number. In the email conversation, there ID.
Exactly. Once again, that's a really good point. Yes, guys, those two answers are really good answers. Okay, so email conversation is a written type of conversation. You have to write it. Okay, and in telephone conversations, you don't have to write anything at all. You just have to talk. Okay, so it's a verbal kind of communication. Okay, and as you mentioned, in telephone conversations, you have to dial a number. Okay, so there are numbers on the telephone, and even when it comes to your mobile phone, you have to dial the number by using your keypad. Okay, and in emails, there is no number. You don't have to dial any number. You just have to type and send it. Okay, so likewise, there are different attributes. Attributes කියලා කියන්නේ characteristics, qualities. Okay, so the meaning of the word attributes is characteristics. Okay, so different channels have different characteristics like this. Okay, so if you take telephone and email, just like we discussed just now, they both fall under telecommunication channels. But even though they both fall under the same group, they both also have different attributes, different characteristics. Okay, so other than that, we can take noise, like noise as another characteristic. Okay, so අපි noise කියන එක ගත්තොත්, noise will be there in telephone communications. Okay, so because if you call someone in a very in an environment which has a very high background noise, the other person will not be able to hear you. Okay, so the message will not be delivered effectively because the other person cannot hear you properly. Okay, so noise will affect telephone conversations. But does noise affect email conversations?
No.
Exactly. Noise doesn't affect email conversations. Okay, because in email, what we do is we just type the thing and we just send. Okay, so it doesn't matter whether we have a background noise or not. Even if there's a very high background noise, it will not affect emails. Okay, so likewise, different channels have different characteristics. Okay, so noise කියන එක telephone conversations වලට affect වුණාට emails will not be affected by noise. Okay, and also guys, if we take the capacity of the message that we can deliver. Okay, so again, if we take telephone conversations and email conversations as an example, in a telephone conversation, like we are talking, right? So we can talk a lot, right? So in a telephone conversation, you can convey a message which has a big capacity. Okay, because you are just talking. Okay, so when you express yourself verbally, when you talk, the capacity that you can deliver is huge. Okay, but when it comes to written communication, you can deliver messages that have a bigger capacity. Written communications වලත් අපිට ලොකු capacity එකක් තියෙන messages දෙන්න පුළුවන්, but it can be inconvenient to some people. Okay, because අපි අතරෙත් ඉන්නවනේ, there are some people who don't like texting. They prefer phone calls because they are too lazy to text. They are too lazy to type. Okay, so they prefer phone calls. ඒ වගේ පුද්ගලයෝ අපි අතරෙත් ඉන්නවා. හරිද? එතකොට there is nothing wrong. There is absolutely nothing wrong in that. It's just a personal preference. Okay, so yeah, so when we talk through a telephone conversation, we can deliver messages which have a big capacity. Okay, but because in telephone conversations we are expressing ourselves verbally. අපි කතානේ කරන්නේ. එතකොට කතා කරද්දී we can deliver messages with huge capacity. But if you take email conversations, usually when you are writing emails, you are not supposed to write like essays and essays, right? It is not a good practice in emails. Okay, so emails are supposed to be like short and sweet. Okay, so emails should be අර මුකුත් අර වැල් වටාරම් නැති clear and concise message එකක් වෙන්න ඕනේ email එකක්. Okay, so we don't write paragraphs and essays in emails. That is not a good email practice. Okay, so when it comes to emails, we can't deliver messages that have a huge capacity. Okay, and sometimes in emails we are supposed to type our message, right? So sometimes typing a message, I mean typing a huge message can be tiring as well. හරිද? අර ලොකු කැපැසිටි එකක් තියෙන මෙසේජ් එකක් ටයිප් කරන එක සමහර වෙලාවට වදයක් වගේ වෙන්නත් පුළුවන් මනුස්සෙක්ට. Okay, because like type කරනවා ඉවරයක් නැහැනේ. It can be tiring as well. Okay, so capacity is another characteristic which differs according to the type of channel. Okay, so capacity, if you take the telephone conversations, you can deliver messages with big capacity, which with the messages that have a huge capacity. But when it comes to email, you can mostly deliver messages which are not that huge in capacity when it comes to emails. Okay, and yeah, and when it comes to these communication channels, so when it comes to these communication channels, if the two parties, okay, so in communication එකකදී there will be at least two parties. You can't communicate alone. Okay, you have to have at least two parties. අඩුම තරමේ parties දෙකක්වත් ඉන්න ඕනේ. Okay, so in communication, when two parties exchange messages across a channel at the same time. So if the two parties, if both the parties are exchanging messages at the same time, this is known as synchronous communication. Okay, so in communication, we can categorize communication into two types as synchronous and asynchronous. Okay, so we will learn about asynchronous in the next slide. So in synchronous communication කියන්නේ when both the parties exchange messages at the same time. Okay, so for example, you can take a telephone communication. Okay, so telephone is the most common example that we can give for a synchronous communication. Okay, because when you are holding a telephone conversation, both the parties exchange the messages at the same time, right? Because අපි ටෙලිෆෝන් කෝල් එකක් ගත්තාම අපි කියන්නේ නැහැනේ අනිත් එක්කෙනාට මං කතා කරලා ඉවරනකම් කතා කරන්න එපා කියලා එහෙම කියන්නේ නැහැනේ. If someone else takes a call to us, අපිට කවුරු හරි කෝල් කරොත් ඒ කෙනාත් අපිට කියන්නේ නැහැනේ ඔයා මේ මුකුත් කතා කරන්න එපා මං කතා කරලා ඉවරනකම් කියලා එහෙම කියන්නේ නැහැනේ. Okay, so like telephone conversation එකක message එක send කරන කෙනා, the sender and the receiver, they both talk at the same time. They both express themselves at the same time. Okay, so this kind of a communication is called synchronous communication. Okay, and so මේ synchronous communication එකක තියෙන disadvantage එකක් තමයි synchronous communication is interruptive. Okay, so interruptive means there are interruptions in synchronous communication. Okay, so like in a telephone conversation, I told you telephone conversation is a synchronous communication method. Okay, so telephone conversations interruptive ne. When we are talking, the other person can interrupt us. Right, they are interrupt කරලා එයාට තව දෙයක් කියන්න පුළුවන්. අපි කියනවට වෙනස් දෙයක් හරි ඊට සමාන දෙයක් හරි නැත්නම් completely off topic දෙයක් හරි මොකක් හරි එයාට අපිව නවත්තලා එයාට කියන්න පුළුවන්. හරිද? එතකොට එයා ඒක කියන්න පටන් ගද්දී අපි අපේ කතාව interrupt වෙනවා. ඒ වගේම තමයි the vice versa of it. We can interrupt the other person and tell something as well. Okay, so this is a characteristic of synchronous communication. Okay, so there are advantages as well because synchronous communication allows both the parties to express themselves at the same time. Okay, that is a huge advantage. But there is a disadvantage as well because synchronous communication is interruptive. The other person can interrupt the conversation. Okay, so these interruptions can sometimes negatively affect some individuals. Okay, so මේ interruption සමහර වෙලාවට negatively affect වෙන්න පුළුවන් සමහරුන්ට. Okay, so sometimes the interruptions don't do any harm at all. Okay, so අපි නිකන් for example, if we are talking to one of our friends for just fun, just to time pass, එතකොට we are not delivering any like ඒ වගේ purpose එකකට නිකන් අර පාළුවේ යන්න කතා කර කර ඉන්නවා නම් යාළුවෙක් එක්ක we are not delivering any important messages, right? We are just catching up with each other. Okay, so ඒ වගේ වෙලාවක interrupt වුණාට කිසි ප්‍රශ්නයක් නැහැ. Okay, because you are not delivering any important messages or urgent messages or any such important messages at those kind of situations. Okay, but important message එකක් හරි urgent message එකක් හරි deliver කරන්න වෙන වෙලාවක මේ interruptions negatively affect වෙන්න පුළුවන්. Okay, so for example, look at the second sentence here. For example, a busy clinician may forget to carry out a clinical task because they have been interrupted while they are busy. Okay, so for example, take a clinician, a very busy clinician. Okay, so just assume that there is a clinician and this clinician is really, really busy today. Okay, so he has a huge pile of clinical work that he is supposed to finish within today. So he is really, really busy with his work. Okay, and then he suddenly receives a phone call from one of his colleagues. කියලා හිතන්නකෝ work colleague කෙනෙක්ගෙන් workplace එකේ ඉන්න colleague කෙනෙක්ගෙන් he receives a phone call. Okay, so and this clinician answers this phone call. Okay, so by answering this phone call, there is a possibility that this clinician will forget a certain task that he is supposed to carry out today. Okay, so එයාට ගොඩාක් වැඩ මං කියවන්නේ දැන් මේ සිනාරියෝ එකේ he is really busy. So එතකොට එයාට කරන්න තිබ්බ වැඩ කන්දරාවෙන් එයාට එක වැඩක් සමහර විට අමතක වෙන්න පුළුවන් මේ ටෙලිෆෝන් කන්වර්සේෂන් එක ආපු නිසා. As a result of engaging in this telephone conversation, as a result of picking up the phone and answering the call, he might forget a certain clinical task that he is supposed to complete within today. හරිද? ඒ call එක ගත්ත එකෙන් එයාගේ attention එක disrupt වුණානේ. එයාගේ attention එක, he was paying attention to his work and this attention was interrupted by answering that call. So as a result of that, he might forget one of his clinical tasks that he is supposed to do. එයාට කරන්න තිබ්බ මොකක් හරි වැඩක් අමතක වීමේ possibility එකක් තියෙනවා as he was interrupted while he was busy. Okay, so this is so that's why I told you these synchronous communication interruptions can affect some individuals negatively. ගොඩක් වෙලාවට busy individuals ලව තමයි මේ විදිහට synchronous communication methods වලින් affect වෙන්නේ. Okay, and then I told you that there is another type of communication, asynchronous communication. Okay, so asynchronous communication is when both the parties communicate but not at the same time. Okay, so for example, we can take emails for an asynchronous communication. Okay, because the sender and the receiver do not communicate at the same time, right? The sender first types out the email and send it, and then the receiver receives it. ඒක receive වුණාට පස්සේ තමයි the receiver will reply to the sender. Sender email එක යවනවා and then the receiver will get it, and ඒක හම්බුණාට පස්සේ තමයි receiver ඊට පස්සේ response to the sender. එතකොට ඒ response එකට මොකක් හරි එකක් sender ට කියන්න තියෙනවා නම් sender ආපහු reply back කරනවා එයාට receive වුණාට පස්සේ. So මෙතන මේ process එකේ කිසිම වෙලාවක the sender and the receiver are not communicating at the same time. They are communicating at different times in separate times. Okay, so this kind of a communication is called asynchronous communication. Okay, so yeah, so in asynchronous communications, අපි කලින් කතා කරපු interruptions නැහැ. There are no interruptions in asynchronous communication. Okay, so for once again, if we take emails as an example, when the sender is typing out the email, the receiver cannot interrupt, right? මොකද receive තාම මෙයා email එක type කරනවා. The receiver තාම email එක ඇවිල්ලත් නැහැනේ. The sender is just typing out the email. The receiver has not even received it yet. So receive වෙලත් නැතුව කොහොමද interrupt කරන්නේ? නේද? So ඒ වගේ asynchronous communications වල interruptions මොකුත් නැහැ. කවුරුත් කාටවත් interrupt කරන්නේ නැහැ in asynchronous communications. Okay, so that is a huge advantage in asynchronous communication. There are no interruptions at all. Okay, but there is a disadvantage as well. Okay, so asynchronous communications will not be effective when it comes to urgent situations. Asynchronous communications අපිට සමහර වෙලාවට පාවිච්චි කරන්න බෑ. සමහර වෙලාවට නෙමෙයි, most of the time we can't use asynchronous communications for urgent situations. ඒ කියන්නේ හදිස්සි situations. Urgent situations වලදී අපිට ගොඩක් වෙලාවට use කරන්න වෙන්නේ synchronous communication channels. Asynchronous communication channels ගොඩක් වෙලාවට urgent situations වල effective නැහැ. For example, හිතන්නකෝ you are a health and social care worker and you get a report from the clinical lab. Okay, so මේ report එකේ තියෙනවා so this report is about a medical testing of one of your clients. Client කෙනෙක්ගේ medical ඔයාගේ client කෙනෙක්ගේ medical test එකක report එකක් කියලා හිතන්නකෝ. So when you read the report, you find that there are some complications. හරිද? So එතකොට as a health and social care worker, you should immediately inform this information to your client. හරිද? එතකොට අපි email එකක් ලියලා ඉන්නේ නැහැ නේ වගේ වෙලාවකදී. Right? Because when you send an email, like you never know when the person will read it, right? එයා කොයි වෙලාවෙ email එක තත්පර ගානෙන් යනවා, but ඒක send උනාට we never know when the person will read it, right? And then you don't even know whether the person read it or not. හරිද? ඒ කියන්නේ ආ email එක කියවන්නේ කවද්ද කියලා අපි දන්නෙත් නැහැ. අඩුමතර මෙයා කියවයිද නැද්ද කියලා දන්නෙත් නැහැ, because sometimes some people have email addresses but they don't even check email addresses. සමහරවිට email address තියෙන කට්ටිය හිටියට emails check කරන්නේ නැති කට්ටිය ඉන්නවා daily. Okay, so එතකොට අපිට guarantee එකක් නැහැ නේ, as a health and social care worker you don't know whether your client will even will read the email or not, at least. Okay, so ඒ වගේ වෙලාවක what you have to do is take a phone call to your client and explain the complications. හරිද? So ඒ වගේ වෙලා ඒකයි මම කිව්වේ asynchronous communications can be disadvantageous for urgent situations, because in urgent situations what we mostly use is synchronous communication. Okay, so that's about synchronous and asynchronous communications. Okay, and the next element of communication system is a type of messages. Okay, so yeah, so messages can be formal messages, informal messages. Okay, so if you are sending messages to your supervisors, your bosses, and like your seniors at the workplace, the messages should be formal. Okay, and if you are sending messages to your friends, your colleagues, then then it is okay if the messages are informal. Okay, so yeah, so there are several types of messages as well. Okay, so voice messages, text messages, email messages. These are the three main types of messages that we mostly use in today's life, in today's generation. Okay, so yeah, so those are three different types of messages: voice, text, and email messages. Okay, so like in the health and social care sector, when you are working as a health and social care worker, your messages, the kind of messages that you will deliver would be hospital discharge summaries, computer generated alerts, laboratory results. So මේ වගේ ඒවා තමයි health and social care sector එකේ වැඩ කරන worker කෙනෙක්ට තියෙන messages වර්ග. Okay, so these are the kind of messages that a health and social care worker will deal with. Okay, discharge, hospital discharge summaries. When a patient discharges from a hospital, there will be a hospital discharge report, a hospital discharge summary. Okay, and then you will have computer generated alerts. Okay, so in a hospital, when we book, when we make a booking for a doctor, අපි doctor කෙනෙක්ව channel කරාට පස්සේ the hospital sends us a reminder, no? We get a alert, we get a reminder from the hospital. So that is an example of a computer generated alert. Okay, and laboratory results is another type of message. Okay, so these are the kinds of messages, the types of messages that a health and social care worker would deal with. Okay, and yeah. Okay, so these messages are computer generated. Okay, so hospital discharge summaries, computer generated alerts, laboratory results. අපි කවුරුත් මේවා දැන් කාලේ we don't write it by hand. අපි කවුරුත් මේවා manually ලියන්නේ නැහැ දැන් කාලේ. They all are computer generated. Okay, so all these messages should comply with the standard. Okay, so මේ messages type වෙන්න ඕනේ standard එකකට අනුව. So this standard is called HL7 standard. Okay, so let me explain you what is HL7 standard. Yeah. Okay, so let me go back to this slide. Okay. Yeah, so HL7 standard, HL7, it's the mostly used standard within healthcare in today's generation. Okay, so what is HL7 standard now? Okay, so HL7 standard. So මෙතන HL කියන්නේ health levels, health level කියන. Okay, so HL7 means health level 7. Okay, so this HL7 is a set of international standards related to healthcare providers. ඒ කියන්නේ healthcare providers ලට අදාළ international standard එකක් තමයි health level 7 or HL7 කියලා කියන්නේ. Okay, so for example අපිට එක standards තියෙනවානේ. දැන් if you take food, we have food related standards, right? ඊට පස්සේ ඊට පස්සේ laboratories ගත්තොත් laboratories වලට වෙනම standards තියෙනවා. ISO standards. Okay, so there is an ISO standard. ISO standards, there are in ISO standards there are several varieties of standards. එක එක ජාති තියෙනවානේ. Some ISO standards are related to food and some ISO standards are related to manufacturing processes. හරිද? එතකොට තව ISO standard එකක් තියෙනවා. මට හරියටම I don't remember the ISO number exactly. So there is it's 17,000 something මට මතක විදිහට, but I'm not sure. මට හරියටම මතක නැහැ. There is a specific ISO standard for laboratories, for clinical laboratories. Non-clinical laboratories වලට තව වෙනම standard එකක් තියෙනවා. ඒ වගේ we have like standards for different purposes, for different things, right? So ඒ වගේ මේ HL7 standard කියන්නේ it's a standard which applies for healthcare providers. Okay, so when we create messages in our workplace, අපිට මේ health and social care sector එකේ අපි messages මේ hospital discharge summaries, computer generated alerts, laboratory results මේ වගේ messages create කරද්දී we need to make sure that these messages comply with the HL7 standard. ඒ කියන්නේ මේ standard එක HL7 standard එකේ කියලා තියෙන නීති රීති වලට අනුව තමයි අපි messages හදන්නේ කියලා we have to make sure. We have to make sure that we follow whatever has been mentioned in HL7 standard when we are creating messages in our workplace. Health and social care sector api create karana messages should comply, should obey the rules mentioned in the HL7 standard. Right. And then the next element of communication system. Had the api communication system ke elements ganane kata karanne. So the next element is communication policies. Okay, so in your health and social care workplace, okay, so when you are working at a workplace related to health and social care sector, there are several policies that you should adhere to. Okay, so there are several policies. Policies can rules. Okay, so there are several rules implemented by your workplace. So as a worker, as an employee, you should obey these policies. You should adhere to these policies. Okay, so communication policies are the policies which are relevant to communication. Policies are the communication policies can and the policies that you have for communication related matters. Okay, so yeah, a communication system can be bounded by formal procedure rather than technology. Example, clinical handover. Okay, so clinical handover එකක් කියලා කියන්නේ like clinical handover means when you hand over your clinical responsibilities to someone. Okay, so අපි අර ඕනේ job එකකින් resign වෙද්දී when we resign from a job, like there is a handover process නේ, not only in health and social care sector, in any industry, in any sort of a job, when we resign, we hand over our responsibilities to the newly recruited staff member, right? So likewise, clinical handover but clinical related එක. ඒ කියන්නේ clinical handover means handing over your clinical responsibilities to someone. Okay, so for example, let's say uh, you are resigning from your current workplace. You are a health and social care worker at a certain workplace, but you found another better workplace. So now you are resigning from your current workplace. Okay, so එතකොට ඔයා යටතේ හිටපු ඔයාගේ clients ලා ඉන්නවනේ. There are clients who consulted you. Okay, ඔයාව consult කරපු clients ලා ඉන්නවනේ. So එතකොට if you leave the workplace without any clinical handover, without handing your responsibilities to another worker, then your clients will be completely lost. Okay, so clinical handover එකක් කියන්නේ එතකොට ඒ වගේ වෙලාවක you can explain your responsibilities to the newly recruited staff member, explain about the nature of your clients, explain about the nature of your clients in detail to the newly recruited staff member, so that staff member can have a clear picture about your clients. So when you leave, your clients will not be lost, right? Because you have handed over your clinical responsibilities to the new staff member and you explained everything in detail, so he is clear about what has to be done. The new staff member is clear about what has to be done. Okay, so then he can take good care of your clients. So your clients will not be disappointed or they will not be lost after you leave the workplace. Okay, so clinical handover එකක් කියන්නේ අන්න ඒ වගේ එකක්. Okay, and okay, so if you take a hospital, there can be different policies. Okay, so hospital එකක් කියන්නේ like there are patients coming in and there are appointments coming in and there are patients who come for surgeries and then there are patients who got recovered and leaving the hospital, discharged වෙන කට්ටිය ඉන්නවා. So likewise, there are different types of processes. No? So in a hospital, there are different types of things happening, different types of processes happening. So for all these different types of processes, a hospital has different policies. Okay, so මේ එක එක processes වලට එක එක විදිහේ processes වලට එක එක විදිහේ policies තියෙනවා. Different policies for different types of processes. Okay, and yeah, so for example, it might be a policy to prohibit general practitioners to obtain medical record directly from the records department without the permission of a hospital clinician. Okay, so in a hospital, there is a record department. So this is the department where all the medical records of all the patients are stored. මෙතන තමයි patients ලගේ medical records ඔක්කොම store කරලා තියෙන department එක. The record department. Okay, so the clinicians, the hospital clinicians can go to the record departments and refer the medical records at any time. Okay, but hospital එකක clinicians ලා විතරක් නෙමෙයි ඉන්නේ. There can be general practitioners as well in some hospitals. Okay, so in most of the hospitals we have general practitioners. Okay, so general practitioners ලට අර clinicians ලට වගේ ඕන වෙලාවක ගිහිල්ලා they are not allowed to make the they are not allowed to access the medical records at any time clinicians ලා වගේ. clinicians ලා වගේ medical records department එකට ගිහිල්ලා ඕනේ medical record එකක් ඕනේ වෙලාවක බලන්න they don't have the permission for that. Okay, so in hospitals, in most of the hospitals, we have a policy to prohibit general practitioners to refer or to obtain medical records from the records department without the permission of a hospital clinician. Okay, so if a general practitioner needs to read a medical record, if he or she needs to, if a general practitioner needs to refer a certain medical record of a certain patient, then first of all, they should get the permission from the hospital clinician. Then only they can go to the records department and access it. Okay, so otherwise they can't obtain medical records anytime, any day, like hospital clinicians do. Okay, so this is a policy that we have at a hospital. Okay, and then agents. Agents is another element of a communication system. Okay, so when it comes to a clinical unit, okay, so in some health and social care workplaces, okay, so in some workplaces that are related to health and social care, we have agents to answer the phone calls. Okay, because sometimes the clinical staff can be too busy to answer the phone calls, right? So ඒගොල්ලොන් clinical staff එක phone calls answer කරයි කියලා අපි expect කරොත් clinical staff එකේ the clinical staff have their own duties now. Like clinical staff එකට they have their own clinical duties, right? ඒගොල්ලන්ගේ clinical related වැඩ තියෙනවනේ කරන්න. එතකොට ඒවා interrupt වෙන්න පුළුවන් if they keep answering the phone calls. ඒගොල්ලෝ phone calls answer කර හිටියොත් ඒගොල්ලන්ගේ අනිත් අර clinical පැත්තෙන් workplace එකේ කරන්න ඕනේ clinical related duties මගහැරෙන්න පුළුවන්. Okay, so to overcome this issue, මේ issue එක මගහැරව ගන්න සමහර workplaces some workplaces use agents. Okay, so agents are there to answer the phone calls. Okay, so එතකොට there will be no interruption to clinical staff. Clinical staff එකට bother වෙන්න දෙයක් නැහැ. The clinical staff no need to bother about the phone calls because the phone calls will be handled by agents. Okay, so there are in some workplaces we have agents to answer the incoming telephone calls. Okay, so that there will be no interruption to the clinical staff. Okay, so summoning then, as I told you, agents la karanne answering the what they do is they are answering the telephone calls. Okay, so when you are as an employer, when you are hiring an agent, you need to make sure that you should hire a person who has good communication skills and good like good understanding capabilities. අර කවුරු හරි understanding මනුස්සෙක්ව communication skills හොඳට තියෙන කෙනෙක්ව තමයි you have to hire as an agent because their duty is their one and only duty is answering the telephone calls. Okay, so because of that, since their main job is to answer the phone calls answer කරන එක යාළුවගේ duty එක ඒ නිසා you have to make sure that you are hiring when you are hiring agents, you need to make sure that you hire someone who is understanding and who has really good communication skills. And also, if you can hire someone who can speak multiple languages කීපයක් කතා කරන්න පුළුවන් කෙනෙක් hire කරන්න පුළුවන් නම් as an agent, that is superb. Okay, because then you can direct like you can direct like you can direct several types of clients to this agent. එහෙම agent කෙනෙක් ඉන්නවා නම් who can speak different languages. ඉතින් අපිට languages අර කීපයක් කතා කරන customers ලා වුණත් agents ලට ඒ වගේ agent කෙනෙක්ට direct කරන්න පුළුවන්. Okay, so for example, if an agent can speak Sinhala, Tamil, English, හිතන්නකෝ, for an example, there is an agent who can speak Sinhala, Tamil and English. එතකොට එහෙම එක්කෙනෙක්ව hire කරොත් you can direct clients who can speak English to this agent. You can direct clients who can speak Sinhala to this agent. And you can direct clients who speak Tamil to this agent. Okay, so likewise මේ එක අර එහෙම එක එක backgrounds වලින් එන clients ලව you can direct to this agent. Okay, so agents is another element of a communication system. Okay, and then there are communication services. Okay, so communication services is another element of communication system. Right. So yeah. Okay, so communication services means like, okay, so like sometimes in some communication devices we have only one communication service. Again, සමහර communication devices වල අපිට තියෙන එක communication service එකයි. But in some devices we have several communication services. So for example, if you take the telephone, like a normal landline phone එකක් ගත්තොත් අපි එහෙම එකක් ගැන හිතමුකෝ. Just a normal landline telephone. Mobile phone එකක් නෙමෙයි, a telephone. Okay, so when it comes to a telephone, the telephone allows you only voice communication, right? Okay, so like නැතුව මේ text messaging, video calling, ඒ වගේ services නෑනේ. Like telephone allows you only voice communication. Okay, so සමහර landlines තියෙනවා that enables text messaging, text යවන්න පුළුවන් ඒවා තියෙනවා. But most of the time අපි අර normal ගොඩක් වෙලාට බහුතරේ පාවිච්චි කරන telephones ගැන කතා කරොත් those telephones allow only voice communication. Okay, so there are no text messaging or video calling in telephones. Okay, but if you take a mobile phone for an example, in the mobile phone we have all these services. We have voice communication, we have text messaging, we have video calling. Okay, so likewise we have all these services in mobile phone. Okay, so that's why I said in some communication devices, we have only one communication service. For example, telephone, voice communication විතරයි තියෙන්නේ. But in some devices, we have several communication services. For example, mobile phone. We have text messaging, we have voicemail, we have voice communication, we have text messaging, and we have video calling as well. Okay, so මේ ඔක්කොම තියෙනවා mobile phone එකේ. Okay, so those are the communication services. Okay, and then communication devices. Okay, so yeah, so the examples for communication devices are telephones, fax machines, and personal digital assistant, PDA. Okay, so PDA කියන්නේ personal digital assistant කියන්නේ it's a device. It's kind of a small device. Okay, so yeah, so these are the communication devices that are mostly used in the health and social care sector. Okay, so then නම් fax machines ටිකක් අඩුයි දැන් කාලේ, but still certain workplaces have it. Okay, තාමත් සමහර workplaces වල fax machines තියෙන workplaces තියෙනවා. Okay, so yeah, so we can use different devices. Different devices are suited to handle different situations and tasks. Okay, so එක devices තියෙන්නේ එක situations handle කරන්න. Okay, so දැන් අපිට සමහරලාට හිතන්න පුළුවන් why a workplace has a telephone and a fax machine both කියලා අපිට සමහරලාට හිතෙන්න පුළුවන්. හරිද? ඒකට there is a reason. Okay, so fax machine එකකින් you can like fax machine එකකින් you can deliver a message which is not urgent. හරිද? ඒ කියන්නේ ඔයාට මොකක් හරි important message එකක් තියෙනවා deliver කරන්න, but it is not that urgent as well. හරිද? ඒක හදිස්සි message එකක් නෙමෙයි. අන්න ඒ වගේ ඒවා you can send through a fax machine. හරිද? එතකොට එයාගේ කවුරු හරි අදාළ එක්කෙනා ඒක fax එක ඇවිල්ලා තියෙනවා දකිනවා. එයා fax machine එක ගාවට ගියාම එයාගේ work office room එකට office cabin එකට ගියාම he or she will see that they have received a fax. Okay, so ඒ වගේ මොකක් හරි ලොකු urgent messages කියන්නේ ලොකු emergency එකක් නැත්තම් urgent නොවන non like urgent messages නෙමෙයි you can use the fax machine to pass messages that are not that urgent. Okay, but telephones ගත්තොත් you should use telephones. You can use telephones to convey urgent messages. Right, if you have an urgent messages, you should convey it through a telephone. You should not be sending faxes, okay? Because fax එක cover මේ ඒ වෙලාවේ receive වුණාට අපි දන්නේ නැහැ නේ ඒක නා කොයි වෙලාවෙ එක කියවයිද එහෙම කියලා එක සමහරලාට fax එක වෙන කෙනෙක් අරගෙන ගියොත් එහෙම වෙන කෙනෙක් අතරපත් වෙන්න පුළුවන් අපි කියන අපි බලාපොරොත්තු වෙන පුද්ගලයා අතරම පත් වෙයිද කියලා අපිට කියන්න අමාරුයි ඒ වගේ ඒවා තියෙනවනේ එතකොට ඒ වගේ situations වල urgent situations වල we should choose the telephone conversations. Okay, so you can use telephone for urgent messages, and for non-urgent messages, you can use the fax machine. Okay, so different devices handle different situations. Okay, so that's why the workplaces have all these different. කිසිම workplace එකක නෑනේ telephone එකක් විතරයි තියෙන්නේ. emails use කරන්නේ telephone එකක් විතරයි තියෙන්නේ. telephone එකෙන්මයි communication කරන්නේ. එහෙම workplaces කොහෙවත් නැහැනේ. Okay, so a workplace has different devices, right? Telephones, emails, fax machines, මේ හැම જાතියෙම devices workplace එකක තියාගෙන ඉන්නේ ඒකයි. Because different devices are suitable for different situations. You can't use the same device for all the situations. It is not effective. You can use, but then the communication is not effective if you do that. Okay, so to make the communication effective, you have to use the correct device for the correct situation. Okay, so that is why most of the workplaces do not depend on just one device. That is why most of the workplaces have all these devices in their workplace. They have telephones, fax machines, laptops or PC, the desktop computers for email communications, and then personal digital assistants. Okay, PDS තියෙන workplaces උත් තියෙනවා. එතකොට මේ එක එක જાතිය devices එක එක જાතියින් devices තියාගන්න හේතුව තමයි මේක. Okay, to make the communication effective, because there will be different situations that you have to handle with different devices. ඒතර අපිට different devices තිබ්බ නැත්නම් you will not be able to handle these situations. So that is why workplaces are having all these different types of devices with them rather than depending on just one type of a device. Okay. Yeah, so in recent times, like recently, people are going for wearable computing. So wearable computing කියන්නේ the devices that you can wear, like the devices that are small enough to become personal accessories like wristwatches and earrings. Okay, so the meaning of the word wearable is the things that you can wear. Okay, so wearable computing means the devices that you can wear. Okay, so that is why with current technology, the manufacturers are trying their best to make the devices as smaller as possible, as tiny as possible. Because if the products are big, you can't wear them, right? You can't wear a laptop, you can't wear a desktop computer, impossible, right? Okay, but smartwatch එකක්, earring size devices, those you can wear, no? Okay, so that's why the manufacturers are trying their best to make the electronic devices as tiny as possible. Okay, because the current trend is wearable computing, the devices that are small enough for you to wear. Okay, and then interaction mode. So interaction mode is another element of communication system. Okay, so yeah. Okay, so interaction mode කියන්නේ how a person will interact during the communication, the way someone will interact during the process of communication. Okay, so for example, if we take ringing tone of a phone, right, we all have a ringing tone in our phones. So if you take ringing tone of a phone, so when the ringing tone plays, අපිට call එකක් එද්දී the ringing when the ringing tone plays, we pay attention to that immediately, right? අපි මොකක් හරි වෙන වැඩක් කර කර නම් හිටියේ අපේ attention එක එතනින් මිදිලා ඒ වැඩෙන් මිදිලා we direct our attention to the sound of the phone, to that ringing tone. Okay, so that is kind of an interruption. Okay, because අපි වැඩක් කර කර හිටියේ and when the phone rings, we paid attention to it. So it is so it sort of interrupted our attention. Okay, so sometimes you can make things non-interruptive as well. Okay, so for example, if you take once again, if you take the mobile phone, if you want to make it non-interruptive, what you can do is put it on silent mode. The silent mode එක දාගත්තාම when you silent mode එක දාගත්තාම when you receive calls, you won't hear it. Okay, you won't hear the ringing tone. Okay, so then when you don't hear the ringing tone, you will not pay attention to it. Right? Your attention will not get interrupted. Okay, and guys, give me 1 second. Hi guys, can you all see the slides? Guys, can you all see the slides?
Yes, miss.
Okay, all right, guys. I'm so sorry for the long pause. Like the laptop just stuck and I got a power cut as well. Okay, so then I had to move shift to my hotspot. Okay, so guys, I'll be extending the lecture a little bit, okay? Because like we lost a considerable amount of time. Ne? So I'll be finishing around 11:30. That will be okay with you all, right?
Oh,
Guys,
okay.
all right, okay. And guys, thank you so much for your patience. Right, so let me check if this is being recorded. Yes, it is. All right, so guys, we were talking about interaction modes, right? So yeah, so I told you that you can make your devices uninterruptive as well. Okay, so for example, if you take the phone calls, if you put the phone on silent mode, you will not you will receive phone calls, but you will not hear the ringing tone. So then your attention will not be interrupted. Okay, and even when it comes to emails, if you keep your notifications off, then you will not be notified when you are receiving an email. Email එකක් එද්දී you will not be notified if your notifications are off. Okay, so yeah, so that's why I said your you can make your communication devices non-interruptive as well, uninterruptive as well. Okay, so you can interruptive වෙන දේවල් uninterruptive කරගන්න පුළුවන් by following those steps, keeping your mobile phone on mute, on sorry, not on mute, on silent, and then turning your notifications off. ඒ වගේ දේවල් වලින් you can keep your devices uninterruptive. Okay, and then security protocol. So this is the last element of a communication system. Okay, so you all know that the important messages. Okay, so the important messages are encoded to prevent unauthorized individuals from hacking those messages, right? So in any sort of uh, device, ඕනෙම device එකක there is a privacy protection, right? So the important messages will be encoded to prevent unauthorized individuals from accessing those. Okay, so likewise, so for example, if we take mobile phone conversations can be encoded as well. Okay, so this process is called scrambling. Okay, so mobile phone conversations encode කරනවට scrambling කියලා කියනවා. Okay, so and the emails can be encrypted. The contents that you have written in the emails can be encrypted as well. Okay, so and guys, I think you might have experienced that when you receive documents from banks, right? Statements hari මොන හරි ගොඩක් වෙලාවට bank statements තමයි. So when they email you the statements, that PDF is password protected, right? So in the email uh, they will mention you that your NIC number is your password. Okay, so you have to enter your NIC number to access the password, or else sometimes it's date of birth. Please enter your date of birth, that is your password. Okay, so this statement is password protected. So only if you enter your password, you will be able to access it. Okay, so I think you might have received those password protected documents. Okay, so the same thing applies to the health and social care sector as well. Okay, so if you are a health and social care worker, and if you send personal very important documents to your clients, then you can password protect those documents. ඔයාගේ client කෙනෙක්ට මොකක් හරි important කියන්නේ වෙන කෙනෙක් කියවන්න වෙන කෙනෙක් කියවන්න හොඳ නැති එයා වගේ client විතරක් කියවන්න ඕනේ මොකක් හරි document එකක් යවනවා නම් you can give it password protection. Okay, so when you send it to the client, you can tell make a password එක your NIC number, your passport number, your date of birth. ඒ විදිහට okay, you can tell them the password. මේ ඔයාගේ මේක මේ NIC number එක තමයි password එක විදිහට දාලා තියෙන්නේ. So if you type it out in the password box, you will be able to access the report or whatever the document. Okay, මේක තමයි අපි password එක විදිහට දාලා තියෙන්නේ. ඒ හින්දා මේ key එක දාන්න ඔයාගේ NIC number එක හරි ඒ මොකක් හරි ඒ password දාලා තියෙන එක enter කරාම you will be able to access the document කියලා you can tell it to the client. Okay, so in health and social care sector we can use this password protection for our health and social care related documents as well. Okay, so yeah, so the choice of security protocol reflects the degree of risk. Okay, so ඒ කියන්නේ මොකක් හරි risk එක වැඩි document එකක් නම් if the degree of risk is very high for a certain document, then you have to choose a very strict security protocol. And if the degree of risk is very high, then you have to choose a very, very strict security protocol to prevent unauthorized accesses. Okay, and if not, if the degree of risk is mild, like not too much, then you can use a normal security protocol. Okay, and if the degree of risk is very less, then you can use a simple security protocol, just a very simple security protocol. Okay, so the kind of security protocol that you have to use depends on the degree of risk the document poses. Okay, so depends on the degree of risk of the document. Degree of risk එක වැඩි නම් you have to go for very strict security protocols. Okay, so yeah, so up to now we talked about communication systems, the elements of communication systems. Okay, so we talked about 8 elements so far. So for a communication system to function properly, all these 8 elements should be well connected to one another. Okay, so if these elements are not connected to one another, the communication system will collapse. Okay, so for the communication system to function properly, we have to make sure that all the elements that we discussed so far are well connected to one another. Okay, and like because even if a single element of the system is inappropriate, ඒ කියන්නේ මේ elements අපි 8ක් කතා කරානේ, මේ 8න් එක element එකක් හරි inappropriate නම් ඒ කියන්නේ තේරුමක් නැති නිකන් සුදුසු නැති element එකක් නම් then the communication system will not be able to perform properly. Okay, so for example, sending an X-ray to a small PDA is unlikely to be useful. හරිද? ඒ කියන්නේ මෙතන X-ray is අපි 8 elements ඇතුලේ within the 8 elements that we discussed so far, type of messages is one element. So that is the second element that we discussed today. හරිද? එතකොට type of message එකක් තමයි X-ray කියලා කියන්නේ. In the health and social care sector, we can take X-ray as a type of message. අපිට ඒක client කෙනෙක්ට දෙන්න ඕන එකක් නේ X-ray diagram එක and the X-ray report. Right? It can be considered as a message. Okay, so if you send this X-ray diagram, this X-ray picture to a small personal digital assistant or a small PDA device එකකට send කළොත්, that will not be useful. හරිද? මෙතන දැන් PDA කියන්නේ communication devices කියලා අපි ඉගෙන ගත්තේ. ටිකකට කලින් in the elements, in the 8 elements, type of messages කියලා element එකක් තිබ්බා, communication devices කියලා element එකක් තිබ්බා. හරිද? එතකොට මේ example එකේදී X-ray වැටෙන්නේ type of messages යටතට, PDA වැටෙන්නේ communication devices යටතට. Okay, so if you send an X-ray to a small PDA device, sorry, PDA කියන්නේ හරිම පොඩි device එකක්. So if you send an X-ray to a small PDA, it will not be that useful because the PDA device is very, very small, right? So the client will not be able to weave an X-ray in such a small device. It will not be clear if you weave it in a PDA device. Okay, so ඒකයි මං කිව්වේ. අර like all the elements, all the 8 elements should be used appropriately. හරිද? දැන් මෙතන PDA එකක් වෙනුවට if you send it to if you uh, if you ask your client to weave it in their laptop, then it is useful because laptop screen is big enough to weave an X-ray image. Okay, and even a desktop computer screen is big enough to weave a X-ray image. Okay, but PDA screen, the PDA device එකක් පොඩි වැඩි to weave an X-ray. Okay, so that's why in a communication system, that's why I told you that you have to make sure that you use all these 8 elements appropriately. Okay, so if even if a single element, එක element එකක් උනත් එක element එකක් හරියට පාවිච්චි වුණේ නැත්නම්, even if one element was inappropriate, the communication system will underperform. Underperform කියන්නේ it will not perform properly. Okay, so දැන් මේ example එකේදී sending an X-ray to a small PDA. A small PDA කියන්නේ it for ඒක අයිති වෙන්නේ අපි කතා කරපු elements වලින් communication devices වලට. Communication yes, tool devices වලට. Communication devices කියලා අපි element එකක් කතා කරේ. So ඒකට තමයි PDA අයිති වෙන්නේ. එතකොට මෙතන මේ example එකේදී inappropriate element එක තමයි communication device එක. එහෙම නැත්නම් small PDA එක because it is too small to weave an X-ray image. Okay, so how can you fix that? You can email it to your client and you can email the X-ray to your client and ask them to weave it in their laptop instead or their desktop computer instead because the screen is big enough. The desktop and the laptop screens are big enough to weave an X-ray. Okay, so that's why all the elements should be appropriately used. Okay, so all these communication systems that we discussed so far. Okay, so these communication systems are extremely important for a workplace. Okay, especially in the health and social care sector, communication systems are extremely important for you to communicate with your work colleagues, your workplace colleagues, and also with your clients, and also with your senior staff like supervisors, your bosses, and the HR team. Likewise, it is communication systems are very important for you to network with your clients and with your work colleagues, and also with your senior staff members at your workplace. Okay, so yeah, so the feedback. Okay, so the results or the outcome that you get from communication systems is extremely important for the growth of the organization. Okay, so whatever the benefits that you get from communication systems, the communication systems වලින් තමන්ට ලැබෙන benefits, exposure is very important for the growth and the innovation of organization. All right. So guys, when it comes to communication systems, we have 3 main communication systems. Okay, so provider to provider communication systems, provider to patient communication systems, emergency alert and notification systems. Okay, so these are the 3 main communication systems that we have. Okay, so we'll first look into the first communication system, provider to provider communication systems in healthcare. Okay, so this provider to provider communication systems allow a healthcare provider to network with another healthcare provider. කියන මේ healthcare providers ලා දෙන්නෙක් අතර තියෙන communication system එකකට තමයි provider to provider communication system කියලා කියන්නේ. හරිද? ඒකනේ provider to provider කියලා කියන්නේ. A healthcare provider networking with another healthcare provider. Okay, so that is what happens in provider to provider communication systems. Okay, so one health care provider, one health and social care provider uh, communicates with another health and social care provider. Okay, so for that they have provider to provide communication systems. Okay, so yeah, so why do a healthcare provider communicate with another healthcare provider? There can be several reasons for that. Okay, so එක healthcare provider කෙනෙක්ට තව healthcare provider කෙනෙක් එක්ක communicate කරන්න එක එක හේතු තියෙන්න පුළුවන්. Okay, so those reasons can be referrals, collaborations, issuing scripts, transferring patients, receiving lab results, processing payments. Okay, so you might know that there are several hospitals and there are several uh, healthcare organizations that work in collaborations. Okay, so මේ වගේ collaborations වලට referrals වලට or else if your workplace is a hospital හරිද, if you are like මේ අපි කතා කරන workplace එක hospital එකක් කියලා assume කරොත්, if you are transferring one of your patients to another hospital, හරිද, හිතන්නකෝ මොකක් හරි ඒ patient අවශ්‍ය treatment එකක්, that treatment is not available in your hospital, so then you have to send the patient to another hospital which has that particular treatment, which has that um, particular facility, right? So in that case you need to transfer the patient from your hospital to another hospital. Okay, so when you are transferring patients also, you will have to contact that hospital, that other hospital that you are transferring the patient to. The patient යවන අනිත් hospital එකට hospital එකත් එක්ක communicate කරන්න වෙනවා. හරිද? එතකොට මේ collaborations, referrals, transferring patients, and sometimes some hospitals receive their lab results. Some hospitals receive their reports or the test results from external labs. There are some hospitals that do not do medical testings inside the hospital itself. Okay, so they have external labs to run medical testings. The medical testings ඒගොල්ලෝ කරගන්නේ external labs වලින්. The hospital එක ඇතුලේ නෙමෙයි, hospital එක ඇතුලේ labs නැති external labs වලින් medical testings කරගන්න hospitals and other healthcare institutes තියෙන්න පුළුවන්. Okay, so අන්න ඒ වගේ වෙලාවකදී එතකොට medical lab එකක් කියන්නේත් healthcare provider, hospital එක කියන්නේත් healthcare provider. So assume that there is a certain hospital. This hospital does not have any medical lab inside the hospital, so they get all their medical testings done through an external lab. Okay, so this hospital is a healthcare provider, and this medical lab is also a healthcare provider. Okay, so when they receive their lab results, to receive the lab results, this hospital will have to keep communicating with that external lab that they are working with. Okay, so it is a provider to provider communication system, because both the hospital and the lab are both the hospital and the lab are healthcare providers. Okay, and then processing payments. Okay, so in these kind of scenarios, healthcare providers have to network with other healthcare providers. So for this purpose, we have provider to provider communication systems. Okay, so these provider to provider communication systems should comply with HIPAA Act. HIPAA කියන්නේ Health Insurance Portability and Accountability Act. Okay, so HIPAA. Okay, so the HIPAA stands for Health Insurance Health Insurance Portability and Accountability Act. Okay, so in most cases, in most of the time, most of the time, provider to provider communications provider to provider communication systems in healthcare have to follow strict guideline for ensuring the integrity of data. Okay, so එතකොට මේ provider to provider communication systems වල හැමතිස්සෙම to protect the privacy of data, they have strict guidelines. Okay, so for example, they have some mechanisms that log users out of the system after a period of inactivity. I think you might have experienced this in online banking as well. ඔයගොල්ලෝ මොන හරි online payments මොන හරි settle කරලා තියෙනවා නම් you might have experienced it, because online payments වල if you log into your account and if you remain inactive for few minutes, like 10 minutes උත් නෙමෙයි 5 minutes to 10 minutes වගේ අතර ප්‍රමාණයක් මුකුත් නොකර, ඒ කියන්නේ log වුණාට මුකුත් නොකර හිටියොත් you will be automatically logged out. Okay, so that system is that protection system is there in this provider to provider communication systems as well. Okay, to protect the privacy of data. Okay, and then we can talk about the next type of communication system, provider to patient communication system. Okay, so in this case, the provider is communicating, the healthcare provider is communicating with the patient. Okay, කලින් provider communicate කළේ තවත් provider කෙනෙක් එක්ක. In this case, in this communication system, the healthcare provider communicates with the patient, not with the provider, with the patient. Okay, so for example, as I told you earlier, when we channel a doctor, අපිට appointment එක තියෙන දවසේ සාමාන්‍යයෙන් පැය කිහිපයකට කලින් we get a reminder from the hospital. We get an SMS, an SMS appointment reminder saying that today at this time you have channeled this particular doctor, so please be at the hospital by this time. Likewise, we will receive an appointment reminder from the hospital. Okay, so that is an example for a provider to patient communication system, because it comes from the hospital. Hospital is the healthcare provider and patient is us. Okay, so the message is something that we get from the hospital to the patient, from the provider to the patient. Okay, and yeah, so this provider to patient communication systems කියන එකත් මේ communication systems should comply with HIPAA. Okay, so the act that we mentioned in the previous slide. So this communication system should also comply with HIPAA Act. Okay, and apart from provider to patient communication systems, there are patient to provider communication systems as well. Okay, so a patient to provider a healthcare communication systems වල වෙන්නේ a patient is communicating with a healthcare provider. අපි කතා කරනවා, අපි patient නම් හිතන්නකෝ assume ourselves as the patient. So we contact a healthcare provider for our requirements, for our needs. Okay, so that is called patient to provider healthcare communication system. Okay, so so some examples for these are nurse call systems. Okay, so we can as patients we can call healthcare workers for our requirements, for our medical requirements, right? So that is an example of a call system is an example for a patient to provide a healthcare communication system. හරිද? මොකද ඒ call system එකක වෙන්නේ patient තමයි healthcare provider කතා කරන්නේ, call කරන්නේ. Okay, so that is an example for a patient to provide a healthcare system. Okay, so and sometimes the patients might need to send some medical documents to their healthcare provider. හරිද? ඒ කියන්නේ සමහරවිට patient කෙනෙක් ඉන්න පුළුවන්. එයාට medical documents, එයාගේ මොන හරි medical reports සහ අනිකුත් medical documents එයාට යවන්න ඕනේ එයාගේ healthcare provider ට. හරිද? එතකොට the patient might have to email it, or sometimes he might have to upload it to a database. මොකක් හරි මේ මොකක් හරි කියන්නේ සමහර වෙලාවට දැන් in Sri Lanka we don't have that we don't have that uploading facility much. Patients ලට අර upload කරන facilities එහෙම in Sri Lanka we are not using that facilities much, but in other countries සමහරලාට portals තියෙනවා. There's a portal, the patient will have to upload their medical records to that portal. හරිද? කියන්නේ ඒගොල්ලන්ගේ මොනවා හරි x-rays හරි medical reports හරි මොනවා හරි ඒ තියෙන medical related documents they will have to upload to a certain database or to a portal. හරිද? ඒක patient එකම upload කරන්න පුළුවන්. හරිද? එතකොට ඒ වගේ එකකුත් අපිට ගන්න පුළුවන් patient to provider healthcare communication system කියලා, because once you upload the document it goes to the provider. So it is the message is going from patient to the provider. Okay, so it is an example of another example of a patient to provider healthcare system. Okay, and then we have emergency alert and notification systems. Okay, so emergency alert and notification systems are the communication systems that we have for emergencies. Okay, so I think you guys, I'm very sure you guys are aware of the ambulance services that we have in Sri Lanka. 1990, the suicide ambulance service. Okay, so ambulance service එකක් කියන්නේ emergency එකකට කතා කරන එක. හරිද? ambulance එකකට අපි කතා කරන්නේ මොකක්ද emergency situation එකකටනේ. So එතකොට it can be taken as an emergency system, emergency notification system. Okay, it can be considered, and the ambulance service can be considered as an example for an emergency notification system. Okay, so මෙතන communication systems වර්ග දෙකක් අපි කතා කරා. So මේ තුන්වෙනි එක තමයි emergency alert and notification system. So the ambulances උත් අපිට ambulance services can also be taken into this category of communication systems. Okay, so yeah, so the importance of this emergency දැන් මේ emergency දැන් අනිත් අපි කතා කරපු communication systems ගත්තොත් provider to provider, provider to patient, okay, and patient to provider. Okay, so these communication systems should be effective. I'm not saying that they should not be effective. Of course they should be effective. These communication systems are very important. They should be used effectively. May communication systems okkoma should be efficient and effective, but this emergency notification systems should be much efficient. හරිද? මේ අනිත් communication systems වලටත් වඩා provider to provider, provider to provider, provider to patient, patient to provider කියලා අපි මේ කතා කරපු මේ තුනටත් වඩා 100,000 ගුණයක් efficient වෙන්න ඕනේ emergency notification system එකක්. Okay, because these emergency notification systems are for emergencies. Okay, so these are for urgent situations. Okay, so when you receive a call or a notification from a patient, you should not take forever to respond. You should respond as quick as possible, as fast as possible. Okay, so you have to be efficient as much as possible. Okay, so all the communication systems that we learned so far should be efficient. I'm not belittling any communication system, but what I'm trying to say here is this emergency notification systems should be ultra efficient. Okay, so they should be much efficient, because these systems are for emergencies. Okay, so when there is an emergency, you should not take 1 hour, 2 hours to sort things out. You should behave as a health and social care worker. You should behave efficiently. You should take quick actions. Okay, so this kind of systems should be much efficient. Okay, so here you can see some communication practices that you can follow at your workplace. Okay, so far අපි මේ වෙනකන් කතා කරේ communication systems. Okay, so now we can talk about communication, just simple communication practices that you can follow in your workplace. Okay, so the first thing is create a plan and strategize. Okay, so guys, in a workplace, in a workplace, when you are communicating, you need to plan things ahead. හරිද? ඒ කියන්නේ මම communicate කරන්න යන්නේ මේ ටික කියලා ඔයාට ඔළුවේ plan එකක් තියෙන්න ඕනේ. ඒ වෙලාවට ගිහිල්ලා හිතෙන දේ කියවන්න නෙමෙයි. You should plan ahead. හරිද? Or else if there's too much to remember, if there is too much information to keep in mind, you can just point them down as several points in a piece of paper. That meeting එකට යද්දී උනත් you should be prepared for it. You can take a piece of paper and point down the main points, that not the entire speech, that will be so tiring to write the entire speech in a piece of paper, not the entire speech, but just the main points that you are supposed to discuss. Okay, so then you will not miss out any information. Okay, so it is extremely important to plan ahead when it comes to communication at your workplace. Okay, and then utilize the right communication tools. Okay, so you have to make sure that you use right communication tools. Okay, so for example, as I told you earlier, if the message is not urgent, you can go for a option like fax or email. But if the message is an emergency, if it's an urgent, important message, then you have to use the correct appropriate tool for that. Urgent message එකකට නම් appropriate හරි tool එක මොකද්ද? Calling, mobile phone or telephone, phone communication. Okay, so likewise, depending on the situation, you need to choose the correct communication tools. Okay, and then you need to have to create, through your communication, you have to create a dynamic and fun working environment. Okay, because guys, if you look at the previous generations, හරි ඒ කියන්නේ අපි දැන් අපේ parents ලාගේ generations හරි parents ලාට උඩ generations හරි බැලුවොත් ඒ කියන්නේ parents ලාට හෝ ඒගොල්ලන්ට කලින් generations හරි බැලුවොත් those generations, they did their job for a living. හරිද? But if you look at today's generation, and even from a survey, it has been found that 88% of the employees expect their working environment to be dynamic and fun. හරිද? ඒ කියන්නේ boring workplace එකක වැඩ කරන්න දැන් කාලේ employees ලා කැමති නැහැ. It has been proven from a survey as well. හරිද? මට මතක විදිහට ඒ survey එකේ තිබ්බ result එක 88% of the employees, ඒ කියන්නේ ඒ survey එකට ගත්ත sample එකට අරගෙන තියෙන employees ලගෙන් 88% of the employees have expressed that they expect their working environment to be fun and dynamic. Like they expect their working environment to be energetic. They are not willing to work in a boring working environment. Okay, and the next practice is offer channels wherein feedback and ideas can be shared. Okay, so you always need to make sure that you offer proper communication channels to share and receive ideas and feedback. Okay, and then another communication practice is avoid information overload. Information overload කියන්නේ when you are communicating, you have to make sure that you are not communicating too much. Like you need to make sure that your message is not too like you need to make sure that your message is not too lengthy or like too like you have to make sure that your message doesn't contain too much information. Okay, because unloading too much information at once will not be effective, because then that will be too much information for the other people to digest. Okay, so the other people who are listening to you will struggle to digest what you are trying to communicate, because there's lots of information. It's hard for them to understand. Okay, so you have to make sure that you avoid information overload. Okay, and then when you're communicating, you need to encourage collaboration as well. Okay, so if you are the boss at your workplace, you have to make sure that you allow collaboration in different departments. හරිද? ඒ කියන්නේ HR department එකේ කට්ටිය හැමදාම HR එකේ කට්ටියත් එක්ක විතරයි කතා කරන්නේ. හරිද? production department එකේ හැමදාම production department එකේ අය විතරයි දකින්නේ, එයාලත් එක්ක විතරයි කතා කරන්නේ. එහෙම වුණොත් the workplace will not be effective. Okay, so you have to as a leader, you have to encourage collaboration. You have to allow different departments to work with each other. Okay, so then the colleagues from different people from different departments can mingle and like they will learn how to work with different people coming from different departments, different backgrounds, right? So you have to always make sure that you encourage collaboration in your workplace. Okay, and information shouldn't be the ultimate object, inspiration should be. Okay, so it is when you are communicating, it is important to make sure that you deliver some sort of an information, but information should not be the one and only objective. Okay, information should be just one objective, but other than information, you have to make sure that your conversation sounds inspiring as well. Your conversation should be able to inspire others, should be able to inspire your listeners. Okay, so information is just one thing. It's not the only thing. Okay, so inspiration is much, much more important. Okay, and make sure that your communication is easy to understand. Speak clearly. Don't use long sentences. You use short and sweet sentences when you are communicating. So then it will be easy for the other people to understand. Okay, and then you have to communicate in a timely manner. කියන්නේ right information at the right time. හරි information හරි වෙලාවෙදි දෙන්න ඕනේ. Okay, so for example, හිතන්නකෝ you are an employee at a workplace. හිතන්නකෝ workplace එකේ in your workplace you get notified that there is a fire risk එකක් කියලා. අද මේ fire මෙතන මේ workplace එකේ මේ අහවල් තැන workplace එකේ මේ තැන fire up වෙන්න risk එකක් තියෙනවද කියලා දැනගන්නවා. හිතන්නකෝ you get to know it at 11:30 am. 11:30 in the morning. හරිද? So දැන් එතකොට මේ case එකක් කියන්නේ it's an emergency case. Right? ඔයා ඉක්මනට react කරන්න ඕනේ එකක්. Situation එකක්. හරිද? එතකොට you have to pass this information to your other employees, to your other colleague employees in a timely manner. හරිද? ඒ වගේ එකක් if you were informed by 11:30 ඒ fire case එකක් වගේ එකක් 11:30 ඒක ඔයා 12:00ට 1:00ට 2:00ට lunch ගන්න ගමන් වගේ කියලා හරියනවද? එතකොට එහෙම කියලා හරියන්නේ නැහැ because it is an urgent වැදගත් නැති එකක් නම් urgent නැති එකක් නම් you can tell it at any time, no problem at all, but in urgent cases you need to make sure that you deliver right information, deliver right messages at the right time. හරිද? timely manner එකකින් communicate කරන්න දැනගන්න ඕනේ. අර මම කිව්වේ for example if when it comes to a fire case, if you get informed about such a case, you should inform it to your other employees immediately. Okay, so now we are so these are the advantages of effect. So we learned about communication systems and we learned about communication practices. Okay, so these are the advantages of effective communication strategies, systems, and practices. Okay, so effective communication strategies, systems, and practices deliver clear and consistent messages. Okay, the effective communication strategies, systems, and practices allow you to deliver clear, consistent messages. Okay, and then effective communication systems and practices are simple, direct, and fast. Okay, and effective communication systems and practices inspire and energize other people as well, and they are user-friendly, human, and personal. Okay, and effective communication systems and practices allow you to gather more information, experience, innovative ideas, and feedback from other people as well. You will be able to express your experiences, and you will be able to give your feedback and ideas to other people, and at the same time you will be able to receive other people's experiences and other people's opinions and feedbacks about you as well from other people. Okay, so there is a two-way there's a two there's a two-way process. You're gaining experiences, ideas, and feedback from other people, and at the same time you can give your own experiences, you can share your own experiences and feedback with others as well. Okay, so effective practices allow you to use multiple as well. Okay, and these effective communication systems and practices are only possible in trustworthy and open workplaces. Are the trustworthy and open working environments වල විතරයි අපිට මේ effective communication systems and practices කරගෙන යන්න පුළුවන්. If the working place is not trustworthy or open, then the people will, the employees and the employers will hesitate to communicate. The people who are working at the workplace will hesitate to communicate. Okay, so these strategies, systems, and practices are for working environments which are trustworthy and open. Okay, so since we learned about communication systems and practices, we can see how to improve these communication systems and practices. Okay, so improve අපි මේ කතා කරන්න යන්නේ how to improve communication systems and practices. Okay, so improve කරන්න කලින් the first thing you need to do is you have to monitor the current effectiveness. දැන් තියෙන effectiveness එක කොහොමද කියලා monitor කරන්න ඕනේ. හරිද? එතකොට මේක monitor කරන්න you can use surveys, questionnaires, feedback forms. Likewise, you can use these documents to gather information about the current communication system. Okay, and other than that, you can හරිද? audits වලට ආවහම the internal audits කියන්නේ the company is auditing themselves. හරිද? ඒ කියන්නේ company එකේ යනකො company එකේ manufacturing department එක audit කරනවා QA department. එක department එකක් තව department එකක් audit කරනවා. ඒ වගේ audits වලට අපි කියන්නේ, and external audits is when you hire internally from an external body. Externally, when you hire an auditor from an external body. හරිද? එහෙම external audits provide කරන companies තියෙනවා, ආයතන තියෙනවා. So you can hire an external auditor from those external bodies, from those external companies. Okay, from those external organizations. Okay, so those kind of audits are called external audits. Okay, so audits වලිනුත් you can audit එකක අපි කරන්නේ හරියට වැඩක් වෙනවද කියලා බලන එකනේ. audit එකක අපි කරන්නේ we check whether the things are going properly, whether the things are happening properly or not at the workplace. හරිද? එතකොට එහෙම if the things are happening properly, then කොහොමද අපි තවත් එක improve කරන්නේ කියලා audit අපිට කියනවා. The things are going well, no issues. So these are some suggestions that these are some things that you can do to improve this good things further. These are some tips for you to further improve yourself. කියලා audit අපිට එකක් දෙනවා මුකුත් ප්‍රශ්න නැත්තම්. Further improve කරන්න මේවා කරන්න කියලා. If there were any problems, they will audit එකකට පස්සේ at the end of an audit, there will be an audit report provided by the auditor. Okay, so in this audit report, if there were any problems, if the auditor spot any problems in the workplace, they will write down all these problems in this audit report, and they will note down the action plans that you need to take to address these problems as well. The problems තිබ්බත් problems මොනවද, problems overcome කරන්න ඕනේ actions මොනවද කියලා they will note down in that audit report. Okay, so audits වලිනුත් you can monitor the current effectiveness of the communication systems and practices that you currently have. Okay, and other than that, meeting minutes, supervisor reports, care plans, complaints, care plans, complaints, ඒ වගේ දේවල් වලිනුත් හරිද ඒ වගේ දේවල් වලිනුත් you can get an idea about the current effectiveness. Okay? And then once you gather all the information about current effectiveness, you have to evaluate these informations. Okay, so you have to, once you gather all the needed information, then you need to start evaluating. Okay, so for example, look at the second point. For example, team meeting minutes may indicate that care staff are having difficulty getting through to the management for support at the weekends. Okay, so this may be further evidenced by staff supervisions in which staff report that feel isolated at the weekends. Other evidence such as spike in the number of incidents that occur at weekends may support this. Okay, so so in this particular workplace, මේ එක්තරා workplace එකක the care staff is facing some problems in contacting the management. ඒ කියන්නේ care staff එකට management එකේ කට්ටියව contact කරගන්න අමාරුයි during the weekends. හරිද? ඒ කියන්නේ මේගොල්ලන්ට මේ care staff එකට patients ලා ගොඩක් ඉන්නවා weekends වල. ඒ හින්දා this care patients ලා ගොඩක් weekends වල මෙයාලට ඉන්න හින්දා they need some support from the management as well to deal with this high number of patients, but they face some problems in communicating in communicating with the management. හරිද? ඒ කියන්නේ management එකෙන් මේගොල්ලන්ට management එක මේ management එකෙන් උදව්වක් ගන්න management එක contact කරගන්න මේ care staff එකට අමාරුයි කියලා තමයි මේ මෙතන කියන්නේ during the weekends. Okay, so දැන් එතකොට මේ වගේ එකකට action එකක් ගන්න නම් first of all you need to prove that there are lots of patients in the weekends. ඒ කියන්නේ weekends වල additional support එකක් Tamanට ඕනේ කියලා prove කරන්න ඕනේ. First of all, like before you take action plans, you need to prove that you need additional support in weekends. හරිද? එතකොට you can take documents like staff supervisor reports and the weekend reports, weekends වල databases, weekends වල data store කරලා තියෙන databases වලින් එහෙම අපිට evidence අරගෙන පෙන්වන්න පුළුවන් that there is a very high number of incidents that occur at weekends. අපිට weekends වල patients ලා ගොඩ දෙනෙක් එනවා අපේ workplace එකට services ගන්න කියලා. ඒ කියන්නේ ගොඩ දෙනෙක් එනවා කියන එක අපිට අර වගේ documents වලින් පෙන්වන්න පුළුවන් reports and අර weekends databases වල ඒ weekends වල patients ලා වැඩිවීම කියන එක අපිට පෙන්වන්න පුළුවන්. ඒ වගේ තොරතුරු ඉදිරිපත් කරලා අපිට ඒක prove කරන්න පුළුවන් that you have high number of cases in weekends. Okay, and then yeah, so that is about evaluation. So once you evaluate, you need to propose improvements to communication systems and practices. Sorry. So once you evaluate, then evaluate කරාට පස්සේ you need to make an action plan in your head. හරිද? ඒ කියන්නේ දැන් මේ issues overcome කරගන්න යන්නේ අපි මෙහෙමයි කියලා action plan එකක් ඔළුවේ තියාගන්න ඕනේ. හරිද? එතකොට action plan එකක් ඔළුවේ තියාගත්තට පස්සේ according to that action plan you have to make a proposal. Okay, so proposal එකක් ලියන්න ඕනේ. In this proposal you have to propose the improvements that you are planning to implement in your current communication system and practices. Again, මේ communication practices and communication systems and practices වල තියෙන මේ current issues වලට මේ current issues solve කරගන්න අපි propose කරන plan එක තමයි මේ කියලා proposal එකක් හදන්න ඕනේ. හරිද? එතකොට proposal එකක අපි කරන්නේ you are proposing the improvements to the communication systems and practices. Okay, so හරිද? දැන් අර අපි කලින් ගත්ත example එකේ අපි කියවනේ management එක contact කරගන්න අමාරුයි කියලා. හරිද? So in that example then අපි if you take that example into consideration in your proposal, maybe you can propose something like you are giving an on-call mobile phone to all the people working in the management එකේ වැඩ කරන හැමෝටම on call mobile phone එකක් දෙන්න ඔයා propose කරනවා. හරිද? එතකොට they have to answer any of the calls that they receive to their on call mobile phones during the weekend. හරිද? එතකොට වගකීම් ඒගොල්ලන්ට පැහැර හරින්න බෑ management එකට. ඒගොල්ලන්ට weekend එකේ on call mobile phones වලට එන on calls වලට answer කරන්න ඒගොල්ලෝ බැඳිලා ඉන්නවා. හරිද? එතකොට you can, that is one thing that you can propose in the proposal. Or else you can make another recommendation. තව දෙයක් ඔයාලට propose කරන්න පුළුවන්. හරිද? You can propose that at least one manager should remain on shift each weekend to support the staff. Okay, so you can propose or you can recommend that at least one manager should be there, at least there should be one shift manager during the weekend to support the staff. Okay, staff එකට support කරන්න අඩුම තරමේ එක shift manager කෙනෙක්වත් weekend එකක ඉන්න ඕනේ කියලා එහෙම දෙයක් උනත් ඔයාට proposal එකේ propose කරන්න පුළුවන්. අර කලින් කියපු issue එක මගහැරව ගන්න. Okay, so these are the things that you can write in the අපි මම කියන්නේ මම මේ කතා කරන්නේ මේ example එක ගැන. හරිද? So දැන් අර මේ වගේ example එකක these are the things that you can propose in the proposal. You can propose to give on-call mobile phones to the management, and you can propose to have at least one shift manager to support the staff. Okay, and yeah, so you present your proposal, and once you present your proposals, your proposal will either get rejected or accepted. Hard the proposal like a senior staff එක කියවලා බලලා if they are happy with it, they will agree to the proposal, otherwise they will reject the proposal. Okay, so reject karot, you have to think of some other action plans and you have to make another proposal. හැබැයි proposal එක accept කරොත්. Okay, so if your proposal got accepted, you need to make sure that you implement all those proposed ideas in your workplace. හරිද? ඒ කියන්නේ අපි proposal එකේ propose කරපු ඒවා proposal එකේ විතරක් නෙමෙයි තියෙන්න ඕනේ. If you get your proposal approved by your senior staff, then you have to make sure that you implement all the things that you mentioned in the proposals. Okay, so once you implement these changes in the workplace, then අපි proposal එකේ mention කරපු ඒවා implement කරාට පස්සේ workplace එක change වෙනවානේ, because those are the things that were not there previously. අපි අලුතින් implement කරපු ඒවා. So now the workplace changed, the environment changed, right? So once the environment එක change එකක් වෙනවනේ, අපි මොන හරි වෙනස්කම් මෙතන implement කරාට පස්සේ වෙනස්කමක් implement කරාට පස්සේ ඒක වෙනසක්නේ කලින් තිබ්බ නැති දෙයක්. එතකොට මේ changes, all these changes should be communicated effectively with everybody working in the workplace. හරිද? මේ workplace එකේ වැඩ කරන හැමෝත් එක්කම මේ changes හරියට communicate කරලා හරියට හැමෝවම දැනුවත් කරන්න ඕනේ. හරිද? Everyone should be informed about these changes, and you should change. Sometimes for some people it can be difficult for them to adjust to changes, right? So you have to make sure that you give enough time, you allow enough time for these people to adjust to these changes. Okay, so you have to be very understanding and you have to communicate these changes effectively to everybody working in the workplace. Okay, and may changes වලට adjust වෙන්න බැරි අමාරු කවුරු හරි ඉන්නවා නම්, if you find that there is someone or some set of people who finds it difficult to adjust to these changes, if you see someone struggling with these changes, you can provide additional training and additional support to these workers. Okay, so එහෙම adjust වෙන අමාරු කව හරි දකිනවා නම් additional training and additional support අපිට එයාට දෙන්න පුළුවන්. එතකොට with that additional training and support, they will be able to adjust to these changes. Okay, so guys, that's all for the lecture. Do you all have any questions? Any questions, guys?
No, miss.
All right. Okay, so guys, then I will be ending the meeting now. Okay, so I have already uploaded this lecture note to to WhatsApp group. Okay, so I will upload in a few minutes. I will upload this to the class notebook as well in the chat. Okay, so you can access the note. Guys, I'm really sorry for the delay that happened today, and thank you so much for being patient with me. Okay, yeah, thank you so much for being patient with me. And I hope you have your time. You have another lecture at 12. Yeah, guys, thank you so much for your support. I will see you next week then.
Thank you, Miss.
No worries,
Thank you.
guys. Bye bye.
Thank you.
No worries.